Hello, how is everyone? I am just signing on. Hello, Kaz Talks. Oh, and here is Holly. We're good to go. Hi, Lipedema Lex. I really want to hear. So let's have a conversation someday. Hello, are you?
There
Yay!
we go. Hi.
How are you today?
Good. How are
Okay,
you
I
doing?
am shutting off the commenting and the requests. Okay. All right. I am good, I think. If I can
Good.
get this. Hold on, let me get my thing set up here.
All right.
Okay.
This is my
Oh,
first live. Here we go.
good. Um,
Here,
I'm an
pink.
old hat now.
It's so good. That pink velvet, whatever that is. I love it. It's beautiful.
Oh, thank you. It was, it's actually what I had. I found that I'm trying to wear whatever I wore in the advertisement. No.
Yeah.
Um,
Loved it. That's great.
I'm like trying. I was like, what can I put that looks similar to Holly's with the color? And then I was like, oh, let me just try this. So anyway.
Silver everything. It's my favorite.
Um,
I'm glad it's back. Yeah.
gee. Okay. Can I just tell you how long I have operated with this little tiny thing, and today it doesn't want to cooperate. But it is what it is. Okay. Maybe.
Mine might fall down. I've got it propped up on some books right now. So that
Uh,
oh,
all right, there we go. I'm going
that's
with
good.
that.
All right. Sounds good. Okay. Hi.
I got my feet up. I've done some exercise. I don't think you can hear my air conditioner. If you do, then let me know, okay? I'll fix
You've
it.
done an excellent job this month.
Thank you. I'm
Yeah.
trying.
Yeah, you've been on it. It's been great.
I'm trying to pull it out of the bag for the end of the month. We'll see.
Yeah, it's awesome. Thanks for
Um,
having me on here. Yeah.
you're welcome. Thanks for coming on. I feel we've talked before, and I feel that, one of the big things that we really don't hear much about is this, how can you use Chinese medicine, and even acupuncture? I mean, it seems to me that there's got to be there's got to be some huge benefit that nobody is realizing, or
Right.
if they are, nobody's talking about. And so I wanted you to bring the information that you have, because I think it's important that, we realize there are other things that we can do, because, I'm always trying to do what else can we do? What else can we try? What else can make a difference? And what are the options? Because, we know that at this point, surgery is supposedly the only way we can remove the diseased tissue, but are there ways that we can actually lessen the effect of what we have? And also, is there, if we do go a surgical route, it's still in our genes. It's still, the what's the word? Not precursor, the predisposition is still
Yeah.
there.
Right. The
So,
addition to
so
it growing back or the swelling and all
yeah,
of this. Yeah.
I was seeing somebody today who was recounting, they've had surgery. I think I don't remember when their last surgery was. Well, it certainly was 6 months ago at a minimum, but I think it was a little bit before that. Maybe it was at the end of the year. Um, and I think they're like officially 12 to 18 months out of their first one. Um, and they were, in a place where it's hot, and they were recounting about how, they were all swollen in their legs. And I was like, see, it's not a panacea after
Right.
surgery. It doesn't mean that it's gone and you don't have to do anything. And, so I think that people who think they're going to go into surgery and they don't have to up their game in their eating and up their game in their movement and up their game in their compression, even if they were doing all of those things at a great, you know, level before, I think it has to become even more important afterwards. So, even with this Chinese medicine, is there stuff that you can do before to just make any decisions on whether you want to go that route? And if you decide to go that route, is there stuff that you should incorporate to make sure you're in the best condition to go under a surgery? And then afterwards, what can you do to support that too?
I
You know?
think that getting in the best shape before a surgery is probably one of the most important things that you can ever do for yourself, because there's a lot of risk with surgery, with any surgery. So yeah, with Chinese medicine, it's going to support your entire system, which is going to be really important. And I don't think there's not anything that's going to beat actually removing that diseased fat, right? So like nothing else is going to remove that diseased fat. Chinese medicine, acupuncture isn't going to get rid of it. But what it is going to do is it's going to support your whole body and just to function better, to metabolize better. It's going to work on everything from the most basic things like your digestive system and out into managing your pain, and even can work on your like mental emotional health at the same time and reducing your stress, which is huge going into a surgery. You don't want to have a lot of stress. So like balancing everything, right? Mental, emotional, physical, all of it. And I think the biggest thing that Chinese medicine can help with, in my opinion, is the pain. So I really like to want to focus on the pain. And
Okay.
for women that don't have pain, there's other things that you can do to help kind of manage the lipedema in other ways. But I'm a part of a lipedema support group that meets on Zoom, and it also meets in person in Portland, or in Beaverton, Oregon, just like outside of Portland. And I've kind of planted the seed. It's headed by a medical doctor who also has lipedema, and she's great. She's amazing. And I kind of planted the seed, like I want to do a pilot study. I want to take, I want to design a pilot study. I want to take a handful of women that want to participate that have lipedema and just kind of, see how much we can reduce the pain with getting acupuncture 2 to 3 times a week for a couple months and track the pain levels and see, because I think that that's where you're going to see the most benefit. The other
Do you think
stuff, it's going to be
does
slow going. It's a lot slower to work on things that are so chronic, and it takes a lot of commitment. So, yeah.
so so do you think that in working on the pain is is the pain really reflective of the inflammation, the level of inflammation, do you
hmm
think?
Yeah, inflammation and just your connective tissue, right? It's this web
Yeah.
of
Yeah.
connective tissue, and the fascia,
Right.
is sits
And now
over the
Dr. Brooks
muscle.
just said,
The fascia
Dr.
covers
Brooks just
the
said it's
body.
that.
What's
Sorry.
what?
Dr. Brooks just, Dr. Brooks just announced that it is a connective tissue disease.
Yeah, so it's a connective tissue disease, which explains that sometimes with the hypermobile Ehlers-Danlos that goes along with that, which is also connective tissue, right? And so there's
Right.
a lot of crossover. They're beginning to understand it better. So that fascia, right, is connective tissue. Fascia sits over the muscles. It encases the organs. It's everywhere in the entire body. And it's one massive system of communication and electrical synapses, right? Which is part of the reason why I think acupuncture works so well. And that's kind of like the Western description that I like to use for people that don't understand acupuncture, is that we're manipulating the fascia. I mean, we can stick a needle straight into the muscle and manipulate the muscle, but ultimately it's going through that layer of fascia. And there's a web and an interaction and a communication that happens in that fascial layer, and that's how it can have these systemic cascade of effect and calm the entire body. You stick a needle in your leg, you feel it in your head. That's one of the reasons why you know, in the Western view. And I want to stay true to Chinese medicine, and I also want to use Chinese medicine words like qi and yin and yang that are a little taboo. Um, or people associate them with like woo woo or magical thinking or things like that. But, you know, it's a different language and it's very quantifiable. If you want to move qi, you know, you stick a needle somewhere and you can feel that qi moving somewhere else. So it's just a really basic way to describe something that's happening in your body. So I want to stay true to that too. But it's working with that connective tissue. So manipulating the connective tissue, and lipedema is a connective tissue disorder. We have pain from that. The fascia gets stuck, it gets bound up, and you want movement. You want the fascia to be free and healthy. It's very fluid. There's like hollow tubules in the fascia that have water pathways and things like that. And that's like the ultimate like healthy fascial picture. And so with lipedema, it's kind of this fibrotic, bound up condition, right? And then you have pain. And so the acupuncture needles can actually physically manipulate that connective tissue and break that up and create more of fluid flow and reduce that pain is kind of the essence of how it would work.
So it would help to affect fibrosis as well, because the fibrosis is helping to create pain. Is that true?
Right. Yeah, because when in Chinese medicine, a very like standard kind of way to describe it in a saying is when there's no movement, there's pain. So that's what pain is. It's a lack of movement. That's how we look at it. It's a very reduced way of seeing pain. Like, what is pain? It's inflammation, but what is inflammation? But ultimately, there's no movement. So then inflammation from that lack of movement cascades. But you want movement. You want to open up that area. You want blood to flow. You want the connective tissue to be able to move freely and all that stuff. So you have this fibrosis and things are really stuck. You need to be able to break that up. And especially in the early stages of lipedema, for women that can handle that, that physical manipulation, whether it's massage or cupping or acupuncture and things like that, you want to increase that movement constantly. And you can't, the more that it sits and the less work you do on it, the worse it's going to get.
Right. Yeah. So, so if somebody was having a session for acupuncture, would they also be doing cupping as part of that treatment? Or is
Yeah.
cupping a whole separate thing?
So cupping, no, cupping. So I went to school for 4 years, and it's a year-round school. It's a lot.
Mm-hmm.
And so in my program, you know, we learn everything from acupuncture, of course, to cupping, to herbs, 2 to 3 years of herbal medicine education. And I had 2 years of manual therapy of body work. So I
Right.
learned Chinese massage and I learned Japanese massage, shiatsu. And so in a treatment setting, I can use all of that to manage
Right.
somebody's health. So it's not just going to be one thing. So I'm going to do a little bit of cupping. I'm going to do acupuncture. I might do a little bit of massage. And then if I think it's appropriate for the person, I can write them an herbal formula based specifically on their illness, on their presentation in the moment, and try to work with that. And I'm going to look at
Mm-hmm.
everything from, so how we assess that person's health. There's no one size fits all medicine. That's the
Right.
difference with Chinese medicine, is
Right.
that I'm not going to prescribe the same herbs for a bunch of different people that have all these different symptoms. I'm going to look at your symptoms and I'm going to decide what herbs are best for your symptoms as you're presenting right now. And it's going to be a process. And so, you know, I'm going to ask a series of questions about like your digestive health. How are your menstrual cycles? Do you run hot? Do you run cold? Do you get overheated easily? Do you sweat easily? How's your energy? I'm going to ask about emotions. You know, do you tend towards irritability and anger? Do you tend towards sadness? And then ultimately, this is going to give me a picture of a pattern. And that pattern can be, you know, lipedema. So lipedema is a damp pattern. It's what we call a damp pattern. So dampness manifests in the body, that pattern, as heaviness in the limbs, which we are familiar with.
Yep.
Fatigue. So I think a lot of women with lipedema talk about how it's hard for us sometimes to get energy, to like get out of bed sometimes. And this isn't something across the board, right? But and other symptoms or signs of dampness in the body, like excessive dampness, is phlegm, actual visible phlegm, like maybe you cough up phlegm in the morning or something like that. Yeah.
Clear my throat right at that moment. Yeah.
And so then based off that pattern, which is dampness, this person presents with a pattern of dampness. I'm going to work with that. And bowel movements typically tend towards loose when you have a lot of dampness in the body. You know, things like that. And then I'm going to look at the person's tongue, which gives me an idea of their organ health. A red tongue, a really red tongue, would show me that there's heat too. And so somebody can have heat and dampness, and then we would call that damp heat. Like, yeah, you do have heat. So you can see heat around the edges of your tongue, and that's
Yeah, but you have got to have the white.
And then we can also see the dampness as that thick white coating in the middle. So I would diagnose you with damp heat versus me, it's not very red.
No.
And so I actually don't have a lot of heat. I tend towards cold, and I tend towards being cold all the time. And that switches, I mean, you can go from cold to heat. A common example of that is like menopause, right? And so a lot of times women will switch to having excess heat when they were cold their whole life or something like that. So anyway, so based off those patterns, I'm going to look at the tongue to confirm what I think after my questions. And then I'm going to feel the pulses. And I'm going to go from there. And I'm going to design an herbal formula for that person to what we call clear dampness. And so it's usually a diuretic. It's usually diuretic herbs that increase urination because you want to get the dampness out of the body, things like that. Yeah.
I've been, I think we talked about this, dandelion tea. I've been drinking some dandelion tea.
Dandelion tea is good for the liver. Things that make dampness worse. Dairy.
Cold drinks, right?
Cold drinks, iced things like smooth raw food. So there's this whole thing about how raw food is really healthy for you. But if you have a sensitive stomach and you tend towards loose stools, I would not suggest a lot of raw food. I would actually suggest more cooked foods and things like that that would help promote better digestion first. Because I mean, if you're eating a lot of salads and you're eating a lot of raw food and you're finding that you're getting loose stools, some people think that that's like a cleansing thing, but you're really not absorbing those nutrients. So so yeah, acupuncturists ultimately, they're going to talk about poop a lot. It's like really important for us as a diagnostic picture. So yeah, people should get used to that. If you're going to be an acupuncturist, you're going to get asked about your bowel movements a lot.
This month I've been doing carnivore. Well, I've been eating meat. Like I may be not doing the high fat portion of carnivore, but I've been certainly having fat, but eating mostly just meats, zero carb. And I remember it was like the third day and I was like, wow, look at that, poop is perfect. I was like, oh my God. That was just so funny because I don't tend to have that. So I was like, wow, like, that's amazing.
I feel like that's where everyone honestly should gauge whether something is working for them or not. Like how are your bowel movements? Like whatever your diet is, follow the fad or don't follow the fad. But if your bowel movements are better, it's most likely good for you. And if they're not, it's most likely not good for you. So, so foods that increase dampness, dairy, cheese especially, I know it's delicious, but that's a really damp producing food. And you can see that in like, you drink a lot of milk or you eat a lot of cheese, you get phlegm, you get phlegmy. That's dampness, right? And so then that's not just up here, that's like translating to lipedema, that's translating to the limbs, to to the arms and growth in the legs and things like that. Greasy food, oil, like heavy fats, and then sugar, especially things like that. So, and yeah, avoiding those, avoiding a lot of raw food. Like I have a smoothie in the morning and my stomach can handle it at this point. But usually I'll put like a little bit of ginger powder in there to try to warm it up and help, help assist my digestion so it doesn't totally hurt my stomach. Because, I really do enjoy smoothies, but if you're drinking them every day and you're having ice water all the time and you're eating lots of dairy, let's say you're doing keto and you're doing like lots of dairy, lots of fat, you're having ice water and smoothies and your digestion still isn't good, then it's probably not the best diet for you at that time.
Yeah, I had to cut out cheese. Um, I guess this is my second week without cheese, I think, which I had suspected at the beginning that I was going to do. So the only thing is I'm having like maybe a teaspoon of heavy cream, which I think is okay, which is better than the cheese because for me, at least cheese with the, kind of mold aspect and also the salt is not a good thing for
Yeah,
me.
right.
But yeah, so that's that. And I guess I'm still having butter, but that's just I am,
I
But
kind
I also believe that for me, I'm having a sensitivity to pork. So I've knocked every pork thing, like, I was eating bacon, I was eating pork rinds, I was eating, some salamis, just a regular piece of a pork chop, we had ribs one day and I'm like, okay, that's done. And so it's funny because it seems to me that you can get a quicker, you can get something quick with that, but no, that has been, and so that's also been gone for like 2 weeks now. And I think although my scale doesn't want to admit to that, I think that my body I don't feel the inflammation that I felt when I was eating those. So that's good.
should definitely, yeah, go with how you're feeling
So
too.
I'm
And the
in,
funny thing about pork is
Mhm.
that pork's actually, so herbs have a thermal nature, food has a thermal nature. Pork's actually considered very warm and like hot, so it produces heat in the body. So, um, yeah, just a side note there. Like maybe because you are somebody that tends towards that dampness and that heat, that pork's not the most appropriate meat for you. There's other, like chicken would be better or something. And then incorporating cooling foods like cucumbers and bitter melon and things like that. Aloe, you know, those aloe juices, things that have a cooling nature are going to reduce some of the heat signs for you. And for
So that's
me,
like a belief that
that's
I
going
have
to
to
make
eat.
it cold. So
Yeah.
like me, I need to eat more warming things like pork or ginger or things like that to produce that kind of heat in my body that my body needs to keep me from getting too cold all the time. So anyway, yeah.
Interesting. Yeah. I don't know that I have heat, but that's fascinating because I'm usually always freezing, and I've had that thermal thing, the thermal, I don't know, is it called thermography, where like Dr. Herbst went over the whole body and she was like mortified at how cold I was. She was like, "Oh my
Oh,
God,
that's
how can
right.
you
You did
have?"
tell me that, but then your tongue is telling me something else. Yeah. Yeah. Well, then there's also the lipedema, which it, it's horrible for our circulation, right? So a lot of
Right.
women will have really cold, like thighs and legs. It's like we just can't get it warm. Like I'll go outside in the wintertime and my butt will just be freezing for hours afterwards and I just can't seem to warm it up. So there's that too, right? So it's just
Yeah.
like blocking our circulatory system.
Yeah, exactly. Yeah, the
Yeah.
other day I was laying outside. It was 85 degrees. The front, I was laying on my back. The front was absolutely like 85 degrees hot. And when I went to get up, I felt the back of my legs and my butt, and it was absolutely frozen. And I was like, how can that be? Like I was sitting at least for a half an hour in that heat, and the
Right.
front of me was, and I was like, that's just absurd. But
So,
that's how it is, you know.
this is getting like a little, I don't want to complicate it too much. I want to keep it really simple. But
Sure.
sometimes that stagnation, right? So like you
Yeah.
don't have a lot of movement, right? Because
Hmm.
your skin's not staying a healthy temperature. It's what we call stagnation. It's no
Yeah.
movement. It's stuck. So from that stuckness,
Yeah.
it can generate friction, which I know
Yeah.
sounds like, so it gets so stuck, it gets all balled up that can actually create heat, and it can show
Wow.
as heat. But that's like, this is where Chinese medicine just gets really layered and really complicated
Right.
from these
Right.
really
Which
basic
is why I have
patterns.
to be a professional.
From these really basic
That's my
patterns,
thinking.
you can have you can have endless overlapping patterns. You can have dampness and heat and cold somewhere else. It can be
Right.
cold in the upper, and we can have heat in the lower half of the body, things like that. So it gets layered, it gets really complicated and complex. So a very skilled Chinese medicine herbalist is going to be to recognize all of that interaction, all of that nuance, and try to deduce where it's coming from, what is the root problem, and how are we going to fix that, versus just like the branches, the symptoms, right? So
Right. Which
yeah.
I think, that whole root thing, it was recommended to me a while back, that I go for Chinese medicine so that I could get to the root cause, because this nutrition and physical fitness expert that I know was like, even if you went for surgery, what is that going to do for you? Because afterwards, you haven't addressed the root cause. So don't you really need to address what is the root cause of this lipedema? And I don't know that anybody knows what the root cause of lipedema is. Probably not. But like you're saying, there are clues that you could look at to improve those aspects within, within the body, right? I mean, it can't, if, if, if somebody with lipedema went for Chinese medicine and, was addressing that, damp pattern, then it has to in some way, make their constitution better than it was before, right?
Yeah. And it's gonna take a long time, and that's where commitment comes in, and being committed to this process.
Like,
And
what's a long time? Like, what's a long time? Are we
so,
talking like, you know,
right.
5 months? Are we talking 5 years, 10 years? You know what I mean? Like,
Well, lipedema is going to be like a lifelong management, right? Regardless of
sure,
whether you had surgery or not. It's just going to be like
right.
a lifetime of management. Um, I would I would be like, so what's the chief complaint? The person comes in and they're like, I have lipedema and I want to fix that. Well, I'm not going to write a treatment plan to fix this person's lipedema, because it's not going to cure lipedema. So I'm going to find, well, what do you want to work on the most? What bothers you the most about the lipedema? Is it the swelling? Is it the pain? Um, do you want to lose weight? Those
Right.
sorts of things. And I'm going to design it around that. And so for the pain, that's something we can work on in a shorter time period and see the more results, right? So I'm going to say, give it a couple months. We're going to work on the pain. Maybe I'm going to do acupuncture and massage and give you an herbal formula. And I'm going to see you once a week for a couple months, and you're going to come back and notice changes by like treatment number 4 is usually what I tell people. Like, you're going to expect to notice something, sure. The first few treatments, the first couple of treatments, it's not going to be major. But over time, you're going to notice, yeah, like this week I actually was able to go on a longer walk. I slept better. I didn't wake up with pain. I'm less swollen, things like that. We're going to track it over time, and it's going to be really tangible. And at the same time, there's going to be all these things like you want to manage to help to help your body function at optimal health. And that's what you want. For somebody with any chronic, progressive autoimmune condition, you want all systems functioning at optimal health. And that's where I think Chinese medicine can really shine, is that we're going to work on your menstrual cycles. If you still have them, like, we're going to make sure that that's good because dampness can also manifest as PCOS and things like that, or fibroids, these masses, right? There's a
Mhm.
lot of like overlap with those sorts of things.
Mhm.
And so I'm just going to look at the person, whole picture, and be like, how's your digestion? Regulate their body temperature, regulate their metabolic function, and get everything kind of lined up. And from all that, they're ultimately going to feel better and really work on the energy, work on fatigue, work on cravings, can kind of do all of those things. And that is going to be like a maintenance thing. You know, I'm going to tell the
Mhm.
person, like, we're going to get your digestion better. We're going to get your pain down. We're going to do all these things. It's going to take some commitment. But at some point, I want to be able to be like, okay, you're free. Come back to me for maintenance maybe once a month. But the person can keep working on these things given the tools that I've then, you know, helped them with, which is like nutritional counseling, all those sorts of things. So, so
And now,
yeah, what's that?
currently, are you doing any of that virtually now that we're in this new world?
Yeah, I think it's possible. It's a little harder virtually because it's such a hands-on medicine, right? And it's been tough for us because I can do herbal medicine virtually. Before COVID hit, it wasn't clear whether we were legally allowed to do virtual herbal prescribing out of state where we're not
Mhm.
licensed,
Mhm.
because I'm only licensed in Oregon.
Mhm.
But when COVID hit and all these people were trying to do virtual consults, we then found out it's actually not legal for us to do uh, herbal prescriptions out of state.
Okay.
Um, so that was a bummer.
Yeah.
It's just, I would love to be able to do that.
Yeah.
But it's just, yeah, it's not possible. So there's some, yeah, it's kind of
Is it,
hard virtually,
is
but
anybody looking into changing that?
I think there's some people that are fighting it. I think, I also know that the FTC and the DOJ are really shutting people down,
Uh-huh.
um, talking about anything to do with coronavirus and Chinese medicine. So
Yeah.
that's a barrier as well. But
Right. Mm, makes
yeah,
sense.
I think there's people fighting for it. I think it might get better because it's actually more people are doing it now too, and so insurance companies are trying to add that
Yeah. Yeah.
because they have to. It's just it's more accessible for some people too. But
Right. Yeah.
yeah.
So, is there anything that you can think of that would be helpful to women with lipedema to, especially now? I mean, regardless of whether they're in Oregon or not,
Right, right.
most people are not having access, right? They're not having access in the same way. Um, so, is there anything that people could start to try on their own, that would be some kind of helpful? Like, can you do cupping at home?
You can
Can
do
you,
cupping.
I think there was some discussion about, massage techniques or like gua sha or
Mm-hmm.
um, I
Yeah,
forget what else you had said, but something along those lines. Oh,
huh?
look, you're instrumental.
Sorry,
Oh, you're musical.
I have to plug my phone in. Okay, yeah. So
Mm-hmm.
I have my cupping set.
Mm-hmm.
And you can cup at home. You can buy a cupping set, online for like $20 off of Amazon or something like that.
Mm-hmm.
And I cup my legs, and I know a lot of women have a lot of pain, and so it's a little hard. But I give it a couple pumps, and I kind of load my legs up at home. I mean,
Now,
if you're okay with having circular hickeys
I
on
was
your,
just going to say, does cupping bruise you? Does cupping bruise? I've actually never done cupping.
so it shouldn't be, it's not a bruise. It shouldn't look like a bruise. It should be red.
Okay.
And that'll go away within a couple of days, whereas a bruise is actually damage to the vessel and will take some time to go away. With cupping marks, they're going to be really temporary. Some people will probably experience it worse than others. as you do more cupping, that will go down. You'll get less reactive to it. You'll get less coloration.
And so the
So
cupping is actually helping to bring the circulation. Is that correct?
yeah, so it's increasing the circulation. It's grabbing, we talked about that fascia, that connective tissue that sits on the surface of the muscles, right? You're like
Yeah.
sucking it up in there, and
Uh-huh.
you're increasing that circulatory action going through there, and you're
Okay.
increasing blood circulation. You're
Okay.
breaking up all of those like micro adhesions, all that
Mhm.
fibrosis, which is what we want. We want to encourage the movement through there.
Okay. And then
Um,
how long do you like leave that on for?
so as long as no more than 20 minutes, because around that time is when, and especially if you have really fragile skin or you're really sensitive, play around with that, but no longer than 20 minutes, because 20 minutes, after 20 minutes, there's a risk of blistering the skin. You can actually have blisters form. So I've only done
Interesting.
one time on a person where
Uh-huh.
it was at that 20-minute mark. One person developed a blister, and none of the other cups had a blister under it. So I just keep it at like 19 minutes and I call it good. Typically, honestly, I'll only do like 10 or 15 because that's about all I can handle. Um, so
So
yeah,
now this kind of thing, but your set that you have right there is professional. Like what you would get
this
on
this is what
Amazon.
I ordered this from Amazon.
Oh, really?
Yeah,
And are those glass?
no, they're plastic.
Okay.
They're plastic. They have a little like pump
Yeah.
set, and you just pump it up like that. And then to release it, you just pull. Wait, where are we? You just pull and
The
it
top.
pops off. Yeah. So, you're maybe only going to do this more in the winter time if you don't want to have marks on your legs all the time.
And
But
then
for me,
how long till the mark goes away?
it depends on how dark it is. For me, I'll have marks for like 1 to 2 days. Some
And then,
people,
oh, well, that's a good question. So how often do you do it?
um, I'd start out slow, but I would do this like every like once a week or something like that. If you can handle
Mhm.
more, you can do more.
Uh-huh.
Um, you don't want to do it too much. You don't want to do it every day because every day, I mean, you're releasing like some metabolic waste in there. So some people might get kind of
Like, like
nauseous from
big
this. They
feedback.
might get a little dizzy. If you do it too much, it's going to be kind of draining. Um, so this in conjunction with like a vibration plate
Yeah.
and some uh, dry brushing, it's going to be
Yep.
great. Yeah,
Okay. So on your right now, you have it on your right leg. Is that right? Or am I
I do.
seeing it backwards?
I have it on my right leg.
So can you show me your left leg for a second? The below the knee, below the knee. No, I don't think you have it. So like right below the knee, there,
Uh-huh.
like kind of on the right side, there, no, on the left leg, like there's like, yeah, like a little bit below that. Wait, go a little bit below that.
Okay.
Where you right there, okay? Like there's like a little kind of like that section is a little bit pronounced. Is that correct? Like, okay, so I think that it's a kind of a hallmark of women with lipedema that on their left leg, right below their knee, they
Uh-huh.
have a little bit of a more pronounced patch
Oh,
that it's
like in
not on the
here.
side, it's like on
Oh,
the front a little bit more.
oh.
Like
Well,
you
having
I think
having my legs down too like this kind of like stretches it and makes it look a little
yeah.
less. Yeah.
Yeah. So anyway, my question was going to be on that particular patch, is it like could you be working the cups right in that section to reduce that how that is raised, or would that not be something that it would do?
I think you could do that. I think that would take a lot of time. You're not gonna,
Mhm.
same with dry brushing. I
Yeah.
think women really get good results sometimes from dry brushing, but it takes that level of like commitment and
Yeah.
doing it all the time to get those results. So
Yeah.
you can
I've
also
been.
do like a sliding version.
Yes. So tell me about that. Is that a different, like that would not be where you use that, the pump thing?
Traditional cupping
Yeah.
is with flame and a glass cup.
Okay.
Whoops, I'm having issues here. So I wanted to try to show you the sliding cupping, but oh well. You can use the plastic cup with the sliding cupping. You just add a little bit of oil or lotion
Yeah. Uh-huh.
to the area, and you give it like a couple pumps. You don't want to make it too tight. You want to make it loose enough that it just kind of grabs that first fascial layer, and then you can slide it around. And so I have a lot of pain in
Uh-huh.
the inner part of my leg, like right in here.
Uh-huh.
I have a lot of pain all the time, and typically it's on my right side.
Huh.
Um, so I'll get a cup and I'll give it like a couple pumps, and then I just put oil
Yeah.
all over here, and I can just kind of manipulate it, and it's painful, but in the end, like it feels pretty good afterwards.
Yeah.
It's not the most
I think
comfortable thing in the world,
I
but
think
and
it
this
seems.
is a really sensitive area for a lot of people, regardless of whether they have lipedema or not.
Uh-huh.
But it's really helpful. I notice my pain goes down a lot when I do this.
Interesting. I
Yeah.
think I've seen people who do that with a cup, but it doesn't have that pump. Like it just sort of suctions to the body.
Yeah.
I don't know.
I think,
The
oh yeah, those are the silicone cups. So those
Yeah, yeah,
ones,
yeah.
yeah, you
Yeah.
can just kind of squeeze the top of them. And I don't typically use those that much. Not that there's anything wrong with those. Those work great too. I just I like the pumps. I like being able to control the pressure and get harder pressure. So
Uh-huh.
yeah.
Which would be affected by how many pumps you do. Is that right?
Yep. Yep.
Nice. Okay.
So that's
Great.
cupping. And then I also wanted to show acupuncture if
Yeah,
people have seen a needle.
yeah.
A lot of people have some fear around it and think it's going to be like getting your blood drawn or something like that, or the needles are really big. Um, and I don't know if anybody has questions too, because I guess you turned the.
I did turn the commenting off because we didn't want that.
Okay. So here's an acupuncture needle. This is pretty standard size acupuncture needle. Kind of hard to
Uh-huh.
see.
Yeah, pretty thin.
It's pretty thin, right?
Yeah.
It's pretty tiny. Um, so this is a guide tube. I use the
Uh-huh.
guide tube. Some people don't, but it's to put the needle in, and then this helps put it where I want to put the needle, and then I pop the needle and remove the guide tube, and then I can manipulate the needle. So I'll show it on, I think my arm might be easiest to see.
And if you were treating somebody with lipedema, would you only be applying the acupuncture needles to areas that they're saying are hurting, or are there portions of the body that you would place them to reduce pain? Like, is there like a pain reduction center? You know what I mean saying?
I like that, the pain reduction center. Um, so, gosh, that's kind of a loaded question. It's a little bit of a loaded question because it kind of goes into a lot of theory, like Chinese medicine theory. So, yes, I'm going to put the needles where there is pain. Um,
Okay.
I'm also going to, based off of that, what I was talking about earlier, that pattern diagnosis. Once I've determined their pattern, it's kind of like I determine what organs are over functioning and under functioning.
Mhm.
Um, so everybody's going to have a really specific pattern. I'm going to base the acupuncture points off of that too to bring the balance or bring the body back into balance. So it's really going to be personal. And Chinese medicine is like the acupuncture is based off of meridian theory. And so I'm using these meridians throughout the body to stimulate areas of the body. So I'm using a meridian, like, okay, there's 12 meridians in the body. So I'm using one of them as the stomach meridian. So I'm going to put acupuncture points on the stomach meridian to stimulate the function, the physiological function of the stomach. And that meridian goes from the toes to the leg, up through the pelvis, into the stomach, and it comes all the way up into the face. And there's some eye points and all of these things. And so that's why when somebody goes to an acupuncturist and they're like, I have no idea why they put an acupuncture needle in my head, you know, when I told them that I had like stomach issues or my foot hurt and they put one in my head, like why would they do that? It's because of the meridian theory behind that and that it's all connected. So that's the Chinese way of describing this interconnectedness. And I think Western medicine is finally getting on board with this and starting to find evidence through the fascia and how the fascia interacts. And there's planes through dissection, through cadavers. They've found fascial planes where they can remove sections of fascia that are all connected and communicate with each other. And they're finding that there's some overlap with acupuncture meridians and fascial planes. So I just think it's only going to get better, that we're going to learn through these two different types from the East and the West, and taking an integrated approach to it. So yeah, I'm going to do points around where the pain is. I'm also going to do points in other parts of the body based off of what that person is coming in for and how they're presenting in the moment. So I'll just show it like how easy it is on my arm because I think that's the easiest. But I place the guide tube on the skin, and then I just pop the needle and I drive it in, and that's that. And I can kind of move around a little bit with it. It's like you don't want to like contract the muscles with an acupuncture needle in because it can bend it, but I'm moving it and it's not, it's not causing any issues. So
and then how do you leave those in? Do you leave those in for 20 minutes too?
So you leave them in for about 20 to 30 minutes. Some acupuncturists will have the person on the table for 45 minutes, which is a really long time. But ultimately, acupuncture is, and then I'll pull it out so you can see. It's pretty simple. And that's that. Sometimes there is maybe a little bit of blood, but it's rare. I don't have any blood. There's no bruising. There's no mark. It's pretty, yeah. And you can do that. You can do that in the legs. I would really highly suggest that women get acupuncture in the legs. I think contraindications would be like cellulitis. You wouldn't want a needle around cellulitis or active infections. Really, really common sense stuff, right? Anything like neuropathy, like diabetic neuropathy, where you can't feel an area. Diabetics often have an issue sometimes in their feet. Like I'm not going to needle the feet if they can't even feel the sensation and they're prone to infection or something like that. Then you're not going to do that. But in a healthy person, lipedema itself is not a contraindication for needling. So you can put needles through that lippy fat, and I would suggest it. Yeah.
Interesting. Fascinating. That's, yeah.
And you can do a similar, thing, massage with the legs with the gua sha tool. Cupping's one version, gua sha is another. This is a gua sha tool that I have.
What material is that? Like jade or something?
This is jade, yeah. I got this for facial gua sha. So it's really nice, kind of mindless activity you can do, and kind of like break up that, or encourage collagen, stuff like that. So you don't want to leave marks on the face. Yeah, you can work out your
doing that on my face, but I have a wood one.
You can kind of like drive it into that worry zone and like break that up. But you don't want to leave marks on the face. Obviously,
Right.
It's not for that. But gua sha traditionally is a little bit more of a blunt edge. This is really smooth, so it's really nice. Gua sha, you wanna keep surface, scraping the
Uh-huh.
surface layer of the skin, and you want to stay pretty surface. So if you're digging in to
Yeah.
like the muscle, like you're, it's more just a massage tool at that point. Gua sha traditionally is meant as like sometimes they use those Asian soup spoons. It's really common.
Mhm.
I actually use one of those. If I'm gua shaing somebody's back, I'm not going to use this because this is going to be more of a massage tool. It's not. It's too smooth. It's too rounded, and it's too thick to produce what I want. I want something that's a little bit more of a thin edge. It's not supposed to hurt. But we go very surface. We're on the very like fascial layer of the skin, and we're scraping, and you want to produce this petechiae. So it's basically tiny little blood vessels getting
Uh-huh.
broken up,
Huh.
and that's going to encourage circulation and
Okay.
reduce pain and things like that. So that's traditionally what gua sha is. I've seen a couple of people use gua sha on their legs where they're like digging in
Yeah.
and they have bruises and stuff,
Yeah.
which is good. I think that that's fine, but it's not really gua sha at that point because gua sha is supposed to be very surface and it's really scraping vigorously to produce like red marks, not bruises, but red marks. Um, yeah.
So really
And
that's
the
the, do you think that is that because of the tool or because of the technique that they use?
So it's a technique, and the theory behind that, you know, a lot of chiropractors have started incorporating gua sha, which they call Graston, and
Graston, right.
um,
And then there's
they
ASTIM too. Yeah.
oh yeah, they use the TENS unit, the electrical stimulation.
Mm-hmm.
Yeah. But the theory behind gua sha, the Chinese theory behind gua sha and cupping
Hmm.
is you do it on the back. You can do it anywhere in
Uh-huh.
the body, but traditionally like on the back,
Hmm.
um, to bring what we call stagnation, blood stagnation, or toxins or things like that out from stuck beneath in here deep in the body, and you want to bring it
Hmm.
out and vent it and bring it out. And so it's kind of the theory behind it. You can also use it when somebody's starting to get a cold.
Mm.
You use cupping and gua sha to open up that area, and it gets rid of the pathogen that's lodged in the skin. So you want to
Mm.
vent that pathogen out of your body. Because if that pathogen, whether it's a cold or the flu, coronavirus, whatever it is, gets
Mm.
deeper into the body, that's where it causes more issues.
Problems.
Right. So that's some of the theory behind it and how gua sha and cupping can go beyond just musculoskeletal treatments,
Hmm.
but get more into internal medicine.
Interesting. Um, so I think on your website, yeah, we're almost at time. I think
Yeah.
on your website, which is called Wandering
Wandering stone.
Stone,
Yeah.
Wandering Stone, and what was I going to say? Hold on. Oh, that you have a I forget what it's called, a questionnaire, right? That you could look at somebody's constitution or makeup. Is that right?
Yeah. Yeah. It's on my
Could
blog. There's a blog about finding your constitution. Yeah.
uh, and so could somebody look at that and determine it themselves, or they need to like fill it out and you would have to look at it?
I think there's a test. I have to check, but yeah, I think you go to a website and you take a test, and then I think at the end it says you're this,
Okay.
and it
So
kind
it
of
is,
describes what it is. Yeah,
okay. It's
I'm
not.
also happy to help anybody like kind of figure it out.
Mhm.
Um, Anybody can feel free to message me. I just want to bring awareness around Chinese medicine. I want Chinese medicine to be more of something that lipedema women can use to help manage their symptoms and things like that. Yeah, that's going to help go into that and reading about on my blog reading about all the different types of constitutions and kind of seeing which one fits best for you will kind of help guide your health and like your decisions around food and certain things like that, activity
Yeah.
levels. Yeah.
Cool.
Also, healing with whole foods is a good source for very basic Chinese medicine stuff. Healing with Whole Foods is a really good book by Paul Pitchford. He goes into some of the constitutional stuff, and then he offers a ton of dietary advice around that.
Awesome. Thank
Yeah.
you.
Yeah.
I think, I don't know, can you see what time it says?
Uh, it's 1:58.
Okay, so we have like 2 minutes, I think.
Okay.
So I just realized that we didn't really talk anything about your personal lipedema journey at all. Do you want to share any of that or not so much?
I I my so I was
I
diagnosed
mean,
in 2018. My mom has it. She's a stage 4. She's pretty immobile at this point.
mhm,
So I see the advanced stages too. I'm really familiar with that. Um,
mhm,
I was the one that got us both diagnosed. I was diagnosed by Dr. Perez in Portland.
okay.
Um, just through going through acupuncture school and everything, I've been fortunate enough to experiment with the medicine to get to a good place. I feel like it's helped reduce my swelling and everything and my
Mhm,
pain. It at least
mhm,
manages my pain. Um, but I do have pain, and I'm
mhm,
like, 36, um, and I work on my feet. Back when I was doing a lot more massage therapy, it was really hard for me if I don't wear compression. I come
mhm,
home and everything just feels like it's sunk into my ankles, and they're just heavy and painful.
mhm.
Um, but I still can handle deep tissue massage, those sorts of things in my legs. I think I still can go to bed and wake up not that swollen in the morning.
Mhm.
Um, and so,
Yeah.
yeah,
And you transformed your body over years time, right?
I did.
Years.
Yeah. And I look at pictures of myself when I was living in Hawaii in like 22, 21 or something like that. And my ankles were bigger. Um, I think that Chinese medicine has supported my.
Oh, I think you went away.
Am I here now?
Yeah. Yeah.
Okay.
Although we're probably going to go out in like 1 minute, not even.
Oh shoot. I just want to keep talking, but okay. Anyway, uh, yeah, I think it's helped me be able to gain muscle mass, honestly. I think that it was really hard for me for years to gain muscle, and it's helped
Hmm.
my energy levels
Hmm.
um, a lot to not
And
have
you,
fatigue all the time and foggy headedness and to feel heavy. I started supporting my system, my bowel movements got better, my menstrual cycles got better, and I was able to put on muscle instead of just being so flabby all the time and just like lifting weights constantly and not feeling like I'm getting anywhere. So,
interesting. That, yeah. I mean, it's complicated, right?
yeah,
It is such a multi-layered, no pun intended,
yeah,
disease that we encounter with all of this. But it's uh, I think any try, you just got to try and try again and see what really works for you. And then like that biohacking piece is just so important because, once you get to one point, then you got to, dial it down to get even, further. And so I think like you pointed out, it is a lifelong process. And, it's always, um, you just always have to keep moving forward, wherever you're at in that process,
yeah.
because, you know, I mean, we have proof that people can make progress,
Hmm.
for
Yeah.
sure. Oh, so here we go. 20 seconds. Thank you, Holly.
Yeah, thank
Maybe we'll have to have a conversation again.
Yeah.
And people take a look at her website and like she said, send her any questions. So I hope you guys have a good rest of the day, and thank you, Holly, for joining, and we'll